Welcome to another episode of the Wellness Digest. Today we're talking about GLP-1 agonists and specifically their connection to the gut and the gut microbiome. And this is such a hot topic in health and wellness right now. You hear so many people talking about, weight loss and also the side effects that come with it. And what we thought might be helpful for today is to really dive a little bit more into the GLP-1 gut connection. We will not be talking about who should be on these drugs or who should not be. We're really honing in on how is the gut connected to, when we take these medications, but also GLP-1 hormones actually is something our gut naturally produces. So these GLP-1 agonist medications essentially are just adding an effect that is already, happening naturally in our body. So we're going to be talking about that, how we can naturally support our body's GLP-1 hormone production, how we can support our body if we are taking these medications, especially if we are facing GI side effects, and just offering some tips throughout.
Before we dive in, I do want to mention that we are not medical professionals, so any information we share is not intended to treat, prevent, or diagnose any disease. We are coming from a place of wanting to educate what we've learned about this GLP-1 connection to the gut, and then hopefully offer helpful tips to anyone who might be on these drugs or who might be wanting to improve their metabolic health through their gut. I also really want to mention that there's a really cool clinical study with omnibiotic detox on individuals who are on these medications, and then also a really great case study we're going to get into. So let's get going.
Yeah, perfect.
So just to go back to basics, GLP-1 stands for glucagon-like peptide 1. And this is produced by the L cells in your small intestine and colon. And really, it's a messenger hormone that signals to your body, I'm full.
Yeah, and one of the things to really emphasize here is, as you just said, these GLP-1 agonists, which are the medications, they essentially mimic something that our gut naturally produces. And so, yes, they're medications, but they're basically just amplifying a system or a mechanism that's already naturally happening in the body. So, these are life-changing medications for some people, especially those who have severe metabolic issues or who are looking to lose a lot of weight. However, one of the big downsides is they can come, for some people, with pretty severe GI side effects. Nausea, vomiting, loss of appetite, diarrhea, bloating, the list goes on. And these symptoms can be so debilitating that for some people it actually makes them want to stop treatment, which, again, if you're relying on them to lose a lot of weight for your own health and also, your long-term, your future health, that can be a real issue. So why does this happen? As Lena mentioned earlier, GLP-1 agonists, they slow down how long it takes for food to travel through our digestive tract. And essentially that just signals to our body that we're full for longer than we would be without these medications. However, one of the issues with that is that if food keeps sitting in your intestines for longer than it typically does, that allows your gut bacteria to feed on this food for much longer, which then essentially causes them to multiply potentially much more, which, can lead to imbalances in your gut. It can also increase inflammation in your gut because, again, if things are sitting there for too long, they start fermenting and just irritating your gut. And lastly, because of that inflammation and potential change of your gut bacteria balance, this can actually lead to something called secondary dysbiosis. So what is secondary dysbiosis? Secondary dysbiosis essentially means it's a dysbiosis, so an imbalance in your gut bacteria caused by something else, which in this case is the GLP-1s.
I think these are, you mentioned the GI side effects, which are so apparent for some people. However, I think now we're getting into the side effects that are a bit more silent and can kind of creep up on people, especially if they're not aware of the risks with taking these medications.
For me, at least, there's really two issues with secondary dysbiosis. One is, of course, when you're already on these medications and you have secondary dysbiosis, that just aggravates your GI symptoms, which makes the whole experience way less enjoyable. But number two, if that dysbiosis dysbiosis isn't treated or addressed, when you come off of these GLP-1 medications, your gut is left in a worse off position. And we know from so many clinical studies and science that if you have dysbiosis and you have inflammation in your gut, that can actually also have a negative impact on your metabolic health, on your insulin resistance, on your nutrient absorption, and so on. So essentially then I feel like you're almost setting yourself up for being slowed down, like your progress is being slowed down because you now have this inflammation and dysbiosis in your gut despite just having taken these medications.
Yeah, another kind of more silent disruptor of these medications is the risk of nutrient deficiencies because you are slowing digestion, you're likely taking in less food, and that can lead to a lack in certain proteins, vitamins, and minerals. To add to that, when a lot of people come off of these medications, they experience rebound weight gain. So that makes sense, right? If you're not having this substance telling your body you're full and curbing your appetite, you are going to start eating in the way that you were before. Or sometimes it's even this hunger and appetite comes back with a greater force.
Yes, exactly. That's actually why so many practitioners, especially practitioners more in the holistic field, if they're giving GLP-1 agonists to their patients, they're strongly also encouraging lifestyle changes, like increasing your workouts, improving your diet to make sure that that kind of like decreases the chances of that weight gain. Now we've kind of covered the basics of what are GLP-1 agonists, how do they impact the gut. Now let's talk a little bit more about the gut GLP-1 connection, because I think that's something that I wasn't really aware of when GLP-1s first started coming out. And only as we were doing more research into this and looking into this more, did I realize and learn that, our gut microbiome, because what you said earlier, our gut naturally produces these GLP-1 agonists. It's part of, what's being produced in our gut. And our gut microbiome actually plays a big role in our natural GLP-1 levels. So how does that happen? First of all, there's certain gut bacteria like bifidobacteria and Akkermansia who are actually linked to stronger GLP-1 release. Secondly, when we eat fiber, especially short-chain fatty acids, that actually directly stimulates GLP-1 production. So our gut, even how our body naturally makes these GLP-1 messengers, our gut is actually closely related to that. And, on the flip side, I brought this up earlier, but just to mention it again, we also know from science and clinical studies that dysbiosis and the low-grade inflammation in the gut that creates can actually blunt the response of our own GLP-1 mechanisms, making our fullness signals weaker, making us more hungry, increasing insulin resistance and increasing visceral fat gain. So that's just a little bit of how important our healthy, balanced gut microbiome is for our own body's natural GLP-1 mechanisms.
Okay, so I think this is a really important point to remember, that a balanced and diverse gut microbiome actually fuels a healthy metabolism and also triggers this natural release of GLP-1 agonists, which in most cases, you shouldn't even need a medication to help you have a healthy weight and a strong metabolism. All right, so now that we've established that the body can actually naturally produce GLP-1s and that is improved by having a balanced and diverse gut microbiome, let's talk about how we can support the gut in order to have healthy metabolism, insulin resistance, and weight. We've talked about this before, a couple of basics: taking a probiotic, especially one that's actually targeting metabolic health. For us, that is Omnibiotic Detox. So taking a probiotic nourishes your gut microbiome by replenishing good gut bacteria and increasing this natural balance in the gut flora. It also supports the gut barrier, which helps with inflammation throughout the body, and all of that contributes to a healthy metabolism. Next, fiber, making sure you're eating a lot of these fiber-rich foods like leafy greens, green vegetables, beans, seeds, all the good things. We always talk about making a fun salad. I think that's one of the really easy and delicious ways to get a lot of fiber into your diet. Exercise, just daily movement, right? It decreases stress, it decreases inflammation, it just helps move everything along in your body, which helps you also optimize digestive function.
Actually, fun fact, there's also some clinical evidence that shows that exercise actually increases our body's natural GLP-1 production. So you're directly,
Win-win.
yeah, win-win, exactly.
And then, mindfully eating, slowing down how you're eating, being present, chewing more. You've heard all of these tips before, but it really helps your body have time to release this GLP-1 hormone and signal to your brain, I am full, I'm satiated.
Yeah. It actually, fun fact, there's often a delay between how fast you eat versus how long it even takes the body to signal to your brain that it's full. So there have actually been quite a few studies shown that if people eat really fast, they actually eat beyond what the body would need if you had eaten slower to give your body the time to signal fullness. So that's just a little plug to encourage people to chew and pause and eat mindfully and, just take your time while you're eating.
Yeah, I feel like that also reminds me of preparing your foods that you're going to have throughout the day. So you don't reach for just a quick snack, or you're getting so hungry that when you sit down, you're just inhaling what's in front of you.
I think that's a huge one, honestly. I feel this personally with myself. If I'm starving, I eat so fast, and afterwards I'm like, what did I even do? I don't feel good. I feel tired, and it's just a reminder to be more mindful about the whole food prep process too. Okay, so now, you mentioned probiotics, and you specifically also mentioned Detox, which is our, gut, liver, metabolism support probiotic. But one of the cool studies on Detox that came out recently that we'd be really remiss not to mention here is in Europe, researchers actually took omnibiotic Detox and studied it in patients who were taking a GLP-1 agonist. So in this case, it was not Ozempic, it was liraglutide. And what these researchers found is that they looked at, what happens if you're giving omnibiotic Detox to these individuals who are taking this drug. And what they found is that, number one, which was huge, the group that was taking omnibiotic Detox actually reduced the GI side effects significantly.
I can imagine.
Yeah. And also reduced the secondary dysbiosis. So even once people were done taking the GLP-1, their gut was left in a much better condition, and they could continue their healthy metabolism journey from there on out versus having to address dysbiosis and potentially ongoing GI effects from that. And number two, they also found that when you paired the omnibiotic Detox with this liraglutide, people could use a lower dose of the GLP-1 agonists while still achieving very similar weight loss outcomes as when comparing it to people who were taking a higher dose without the Detox. And the lower dose, again, also helps because lower dose often means fewer GI side effects, less impact on secondary dysbiosis. So really that was a win-win for patients.
I love that. Yeah, and then even here in the US, we did a case series with a practitioner partner, Dr. Leah Linder, and she looked at patients who were trying to wean off of a GLP-1 agonist medication, and they were worried about weight gain. And so she combined their weaning off process with omnibiotic Detox and found that a lot of these patients were not regaining weight as quickly as people who were not on this probiotic. Some even continue to lose weight. And certainly they all found an improvement in the GI side effects.
Definitely, yeah.
So this is really life-changing, especially for the individuals who are on these medications, not for aesthetic purposes, but because they really are changing the trajectory of their health.
Yeah, for sure. And again, why does this matter, these clinical findings that we just spoke about? Well, number one, comfort for the patients. As you just mentioned, if someone truly is looking to lose a lot of weight, they've tried so many different ways, and this is important for their future health, then knowing that they can go through this in more comfort with fewer side effects is huge in itself. Secondly, obviously, reducing the risk of getting something like a secondary dysbiosis, which can leave you with, additional GI symptoms, inflammation throughout the body, that in itself is also hugely valuable. And then, it just also supports people in that transition, again, away when they're ready to wean off of these GLP-1s, it just is a way to support them, support their gut health and their metabolic health overall.
Yeah, because I feel like that's probably the goal for a lot of individuals on these medications, to be on them for a short term, reach their weight loss goal, but then learn, how can I actually approach my lifestyle now to keep the weight off and live healthier?
Exactly. So let's close out this episode. This was definitely a bit of a more sciencey one, but we're sprinkling the science throughout as well sometimes. So to recap, GLP-1s are part of our biology. Our body makes these GLP-1 hormones. They signal to us if we're full or hungry. However, these medications, these GLP-1 agonists, are essentially just adding on to the effects of our natural GLP-1 production to help people increase these, their feelings of fullness and their metabolic health. One of the biggest challenges is GI side effects, and we've just talked about that. And really, by focusing on how we can support our body's natural GLP-1 hormone production, as well as, if we are taking medications, support our gut microbiome to reduce these GI effects and reduce the risk of secondary dysbiosis, that can really be key to supporting people who choose to take these medications.
Yeah, and again, a major tip we can offer here is trying omnibiotic detox, because we've seen in this European clinical study and then in case studies here how effective it can be in reducing these GI side effects and also supporting people as they're weaning off of the GLP-1 agonist medication and not regaining the weight, actually sometimes continuing to lose the weight and then reducing that risk of secondary dysbiosis. And then I think another really important takeaway from today is that the gut really is one of your body's health control centers. And no matter if you're on a medication like an Ozempic or not, nourishing your gut, replenishing it with probiotics, and improving this balance and diversity of gut bacteria so much influences your metabolic health, your energy, and just your overall well-being. So it's something you can do to improve your health span, no matter what situation you're in, and especially if you're on a prescription medication like Ozempic.
Yep.
Thanks for tuning in. Like, comment, and subscribe, and let us know any questions or topics that you'd like us to cover.